Today we are going to talk on checklist which is called modified checklist for autism in toddlers, that is called M-chart. Yes, so let us understand about M-chart. What does it mean, what are the domains, and what are the scoring procedure of M-chart. So let us see what is M-chart. It is a screening tool used for the early detection of autism spectrum disorder when you have suspected to the child have an autism. Then screen children, those who have missed during the screening procedure, or you have just suspected and you have just missed. So in that way also you can use this M chart. And it was developed by Baron Cohen et al. That means there are more than one professional making this M chart, and they have published in 1992. So M chart has two levels, level 1 and level 2 screenings. Let us see what are those. So level 1 screening has children in general population. That means it's a general population where you screen, where you just try to give whole population and then try to understand what population does the child have a suspicion of autism. It is used by the primary care physician, can be used when they come to their clinic, or any practitioner or special educator. And the brief format they have where they can note down all the informations. And then most of the screened are not risk at a developmental delay. You cannot say the child have some sort of developmental delay characteristics or not in level 1, because it is just a general checklist in level 1. Whereas in level 2, selected group, like after level 1 you will get some group of children, then those selected group of children will be identified to be screened at a risk. This will be administered by the specialist and included parents reports and professional observation. All the information will be taken by the the professionalist or maybe a specialist. And it is a more time consuming, where the professional try to spend more time observing the child and assessing the child. So anyways, it's time consuming. So why screening via F-chart? Why we have to do a screening via M-chart? As you know that 1 in 125, 3 to 6 years, and 1 in 85 in children 6 to 9 years are diagnosed with ASD, particularly in India by 2018 by Incline research. So as you know that autism children are increasing drastically day by day, so it's very important to screen and provide a particular intervention. So you can see status of CDC, that is Center Disease Control 2007. Even they have mentioned that 1 in 150 children are diagnosed with an autism, with a national survey of 1 into 91. About 17% of children under the age of 18 are affected by the developmental behavior or learning disability as well. That's why it is very important to screen out and do the differential diagnosis and find out exactly what is the problem of the child. As I said you, that autism is the fastest growing development in India as well as in US. So make sure that we need to identify accurately and provide the intervention. So M-chart has certain goals. Let us understand what is that. It gives a high positive predictive power, that means ability to identify definite clear characteristics of autism without misdiagnosing. It also screens much wider sensitive, that means it can identify more children than earlier, which we used to do with the other checklist. Then autism can be difficult to identify at the early age, yes, correct, because even if you start at 3 years, it will be very difficult to observe, because still that is a developmental period of the child. So 30% of children with autism in that period seems to be a normal development. That's why we need to be very careful, and with this checklist you can assess at the age of 30 months. So to account the potentiality of this M chart, it can be administered at 30 months, as I said you. Then let us see the different components given in MChart. There are different domains you can say, or screening areas you can say, which they have mentioned in the MChat. That is social play, social interest, pretended play by using the object or toy, just pretending, just yes. So in that way, and the joint attention, sharing of an activity with the partner. So whether the child has this ability or not. So with the help of these characteristics, we can just try to rule out whether the child have some suspicion of autism or not. Then proto-declarative point, this you need to remember, a joint attention behavior in which the point is intent to share the experience. That means, for example, if the child shows a dog in the park to the parents, then that means the child is sharing his or her experience to the parent. So that is why, pointing to the particular thing, that means sharing the option. And use of expressive and receptive languages is also very very important while doing the screening. We need to check it out. Then functional play, using particular object to have a play to engage with it. Then proto imperative point, now the difference between proto declarative point where he is sharing their experience, where here in proto imperative point he using his index finger to obtain the object. I want that. For example, if the boy point out, I want I want that object, I want that toy, I want that things to eat, that means he is doing the pro imperative pointing for his expressing the needs. Motor development, then you have a rough tumble play, then you have a sensory impairment. These are all items which available in the component to assess. Then let us see what are the instructions, how we can use this MChart. Can be given to the parent or guardian before the child visit for the standardized assessment at specialist. So it can be given to the parent so that they can sit at the waiting hall or at the room, so that they can give those information for further assessment. It can be scored by the pediatrician nurses rapidly, and it will take not much time. So discussion with the parent during the visit plays an important role to share the information. Then questions or concern can be resolved during the follow-up interview. So this MChart particularly have follow-up sessions to find out the the information of the child. Now the checklist look like this. So now you see that here they have a direction which tells you clearly that please fill out about how your child usually is. Then please try to answer every question. That means the parent has to answer each and every question. So if the behavior is very rare, seen one or twice, please answer as if child does not do it. That means if the behavior is happening very rarely, that means you must think that it was not happened. So in that way you have to mark. So here the parent have to read and they have to mark with S and no, S and no. So let us just mark like this for practice. I'll just mark here no. Just this is for just a practice and a sample. I'll just mark no. Here let us say yes, here let us say no, here let us say yes, yes, no, yes, no, yes, no, and yes. See, let us see, we have marked, we have finished our checklist. So we have to count how many n you have. So 1 2 3 4 5 6 7 8 9, then you have 10 11 12. So 12 no's, that means 12 no's you have in the 12 no's you have find out in the screening checklist. We will try, just keep in the mind that 12 no's and remaining are yes, we will try to answer when we go for the scoring part. Scoring of MChart tells that it can be finished within 2 to 5 minutes. It's very easy. Then follow-up interviews for children who fails 2 critical items. That means if the child fails 2 critical items, then they will be called for the follow-up interviews to find out more information. I will show you that how you can do. which is conducted. So we will discuss what is critical and non-critical item as well. And follow-up interviews decreases the rate at which the false positive diagnoses are obtained or not. So that is very, very important. So let us discuss the critical item. So these are the critical item. So for example, if the item is scored no, okay, it indicates a risk for autism. That means item number 2, 7, 9, 13, 14, 15 of that checklist, if it is mentioned as a no, that means the child has at a risk. And in the non-critical item, so if the item is scored no, it indicates a risk. So these are the questions, these are the items which is given in the checklist, and this particularly says that child, if you say no, that means the child is at risk. If it is yes, that means the child has no difficulty. So as I said, if the child fails, two from here, three from here, the child will be called for, for the follow-up sessions to get more information. Then scoring or algorithm is like, if the total score of 0 to 2, if you see, we have scored I think 11 SS, right? So this we can go and see back later. So here, total score of 0 to 2 is says that the child is at low risk. Yes, that means if the child is younger than 24 months, screen again after the second birthday, that means after 2 years, and no further action required unless their observation says that there is a risk of ASD. If the score is 3 to 7 years, then it's a medium risk. Then that means you need to administer the follow-up sessions, you need to call to the child and get more information. And if the score remains 2 or higher, the child has screen positive. That means if it is more than 3, if it is more than 2, that means child is positive with the screening. And action requires, that means he has to go for the further diagnostic evaluation in level 2. So if score of follow-up like 0 to 1 or 0 to 2, that means the child shares a negative result, and they may not have any condition of autism even after observation. If the child scored 8 to 12, now remember we have scored around 11 no's, so that means the child falls under 8 to 20, that means the child is at high risk. And you can bypass your low risk and medium risk. Directly you can follow up for the medical evaluation, immediately you can follow up for the diagnostic evaluation, and then you can refer them for early intervention so that it can plan for the early intervention. So I think I have understood something about YM chart. So for today that's it. We will see into the next topic the next time. Bye bye.